My name is Sira Boats and I am a dementia specialist and also occupational therapist of over 30 years, and I'm also a daughter of dementia, and I'm here to help you find hope on the dementia journey. And today we're going to talk a little bit about microtraumas and what that means. So microtraumas are actually not very well understood, and I want to define that for you today and the impact of microtraumas on your emotional responses and on the behaviors of your loved one. So microtraumas can traumatize us in the long run if we're not careful, if we don't recognize them in the moment, and if we don't take control over the situation. Let's start with our person living with dementia. Microtrauma, well, both for our person living with dementia and our caregiver, is a painful trigger that evoke a strong emotional response in our brain, which can result in a change in our behavior towards other people. So it is a trigger that causes a negative emotional response in the moment towards other people. And it's a buildup of negative experiences that then sets us off, and it's an automatic response in the brain. It's a primitive survival response. So if microtraumas build up and they're not resolved, it can trigger this behavioral outburst in both the caregiver and a person living with dementia. So for your loved one, microtraumas may occur and become a trigger when we are not meeting our person's needs consistently. For example, they have unresolved boredom. They are feeling lost because they're disconnected. They're not oriented to themselves, to place, to time, to the expectations in that space. They feel purposeless. They may feel like they're a burden to other people. They may feel unloved. They may have physical pain or something like constipation that they're unable to communicate that's going on. They may have lost their ability to communicate and they're not able to communicate what they're feeling internally, and they lost their independence, and they don't have the ability to manipulate their environment in the way that they would like to. So all of these factors may become little microtraumas that build up over time. So it's like a paper cut. When you get one paper cut, that may be fine, but if you get 1,000 paper cuts in the same spot, that can become a wound that you need to take care of. So microtraumas are similar. If we leave them unresolved, they can become a trigger for that negative behaviors. So for our caregiver, the microtraumas make it look a little bit different, and microtraumas are related to the loved one with dementia's behaviors. Maybe it may also relate to the caregivers helping to do tasks or being involved in situations and navigate situations with a loved one, and there are recurrent breakdown in that situation or in that task. This can become a microtrauma for the caregiver, such as difficulties during toileting or bathing or taking medications or during mealtime, or just that perception from the caregiver's side that they have lost their loved one, that normalcy is gone. Stepping into that caregiver role and taking on more responsibility, that can be a microtrauma in itself. So microtraumas may be seen as small, unforeseen incidents or small events where things go wrong. It doesn't go as planned, and it triggers a negative emotion in the person, and it can interfere with the joy. So where you start feeling that you are having more difficulty and trauma in your day than you're having joy, that means that microtraumas have become triggers for you. Things like recurrent hallucinations in your loved ones, delusions, wandering, or even eloping. Of course, those are little traumas as well that puts you on edge, so that you'll be more likely to have a strong emotional response to a seemingly small situation. So how do we recognize microtraumas? If you have recurrent feelings of being apprehensive about a task coming up, or about a situation coming up, or an interaction, if you have uncontrolled negative response to with your loved one in specific situations or interactions, you have irritability and anger and sadness that you're not resolving, and it's preventing you from engaging with your loved one, you are suffering from microtraumas. And so how do we navigate this? There is hope in this situation. We can navigate it. And it starts with, first of all, with recognizing the patterns in your day, recognizing the patterns of your interaction with your loved ones. What does that look like? What does your emotional responses look like to which tasks or behaviors or situations are those negative responses linked to? Try to find out what is the barrier in those tasks. Why is it difficult? Why is it becoming a problem? And then get a specialist to help you. It can be a dementia specialist. It can be another person that has knowledge of the dementia that can come in and help you problem solve. It's very important that you inquire knowledge of the type of dementia a person is living with. It's very important to know the stages of the dementia journey, because your person's needs are going to change through these different stages. Their environmental setup needs, the way we talk to them, the way they receive and process information is going to change. And if we know how to meet them where they at, then we're going to be more likely to overcome the barriers, and we will have less microtraumas in our day. So microtraumas should not be the rule of our day. That's not normal for dementia. A microtrauma should be the exception. And through increased knowledge and confidence with the dementia journey and with the stages of dementia, you will be able to navigate these microtraumas. And we hope that you can find hope and joy on this journey. Please follow us for more. We also have content on grief and loss that can also be a microtrauma for you when you are experiencing intense grief due to this dementia diagnosis. And we also have information on the emotional roller coaster, which microtraumas, grief and loss can put us on that emotional roller coaster, and how do we get off. For more information, please go to our website and sign up for our newsletter and our caregiver support group, and we have many more resources there for you. Thank you for watching.